These are the instructions for collecting sample for Genova Diagnostics Organix profile. All this will come in this box. These are the contents of the box. An ice bricks that needs to be frozen as soon as you open the box. Some instruction sheets regarding mailing. The mailer with the billable stamp that will be affixed onto this mailer in which this will be shipped out. The other instructions for how to collect the urine sample. The plastic bag in which the container containing the urine sample will go in. The blotting paper to absorb any spills. And the requisition slip. The first is about the collection of the urine sample. Some of the instructions over here which we will highlight. The first thing is that it is best to ship the specimen within 24 hours of collection. Number two, it is not necessary to discontinue any supplements prior to collecting the sample because you want to see how you're doing on your supplementation and to assess any malabsorption issues. The other thing is to decrease the fluid intake to avoid excessive dilution of the urine sample, and it's best that we restrict our fluid intake to 3 8-ounce glasses or less for 24 hours, and on the night before the collection of the urine sample, do not consume anything after 8 p.m. or make sure that if you do, then it's not more than 8 ounces. And do not collect the urine during menstruation. And this vial does not contain any preservatives, so it should not be rinsed, otherwise it will dilute the sample. So before you collect urine sample, you should fill out the requisition slip. This slip actually has, this other sheet contains information from the practitioner. This has the practice information, so the slip does not need to be signed. This is based upon whether we're going to bill insurance, Medicare, or the practitioner or the patient by cash. This has all the ICD-10 codes based upon a diagnosis. Over here is we will select which test we're doing, and we'll be doing this test. And over here goes the date of the collection of the sample. On the back is basically all your personal information. You fill out your name, address, date of birth, all that information. Your insurance information and the billing information. Over here is the payment, whether it's from the practitioner or the patient, which is typically in our practice you, the patient. And then the patient method, whether is it via check or credit card, you fill out the information, and then you sign this patient responsibility for taking onus of the payment. This eventually will go inside the outside sleeve of this plastic bag. So you take a clean Tupperware and take the first morning void, and with this pipette you actually drop the urine inside this plastic container, and you can take a black marker and put a mark at the 12 ml level, and up to this level you should put the urine. You should not go above it because this eventually will be, once you collect urine, it needs to be frozen. So once you collect the urine, you put this vertically inside your freezer and let it freeze. Again, I mentioned up to the 12 ml mark. And once it's frozen, it goes inside this bag along with the blotting paper to absorb any leaks. And you can put the ice block inside it and seal the bag. Put the requisition slip in the outside, or it can also go in the outside sleeve of this plastic sleeve of this cardboard box. This goes inside this. You seal it. And this eventually goes inside this mailer. You affix it on top of this thing and keep this part yourself so that you can track it. Please make sure that it is mailed out from Monday through Friday. There is a Saturday delivery, but nothing on Sunday. This will go inside it once it's shipped out. There are some additional instructions regarding making sure that your personal data is definitely written over there. And all collection tubes and vials must also bear the name and date of collection on it. So you can actually take a black marker and write on top of the tube. And this is just about the shipping instructions. Please read them in entirety. And this is a little notice to the Medicare patients also. So some of the services are covered, some are not covered, so it's important for you to be aware of that. And this concludes instructions for Organix test.